With Amare. So today we're going to talk about cellulitis. Now, this is super common post-op, like very common post-op, more than you'd think. It's basically cellulitis, cell, which is a cell or like skin and stuff. Itis just means infection, irritation, redness. It actually means swelling. It means like swelling, hot, red, all that stuff to the area of cell, so skin. So basically cellulitis is when your skin gets really hot to the touch, red, puffy, and a lot of times it's a bacterial infection, but a lot of times it's misdiagnosed, especially post-op. So two different ways this can happen. One, you start getting that like red, hot to the touch, swollen, super big patch, right? So then your doctor either thinks, one, it's a seroma, or you actually get checked and it is a bacterial infection and it's cellulitis. So if it's a seroma, they try and drain it. Most of the times, it doesn't drain. Because guess what? There's nothing in there. We'll get to that in a second. So that's one path they take. The second path they take is it's a bacterial infection. You get antibiotics, you're fine. Okay, cool, it goes away. But you still have swelling in the area and then it gets really hard. All right, we'll get to that in a second too. Number 3, it's not cellulitis. It's actually from your garment. So the areas that are red and hot to the touch and swollen can be garment burn. A lot of times cellulitis comes along with blisters. And what is garment burn? I have a whole video on it. Go watch it. But again, it's that area that's a lesion or swelling or like a giant blister or like a big patch. Now, a lot of times cellulitis isn't just a blister. It's like a whole area of your skin that's red and hot and swollen to the touch. Again, they'll check to see if you have an infection. If you do, they'll treat it with antibiotics and it goes away. What happens when it keeps coming back? When that bacteria keeps coming back? Well, maybe it's not actually bacterial. Just because the antibiotics are helping to take down the swelling and the irritation to the skin doesn't mean it's an actual bacterial infection. So a lot of times, cellulitis is misdiagnosed. Now, let's talk about those 3 scenarios I talked about. Number 1, a seroma. They'll, again, I have a whole video on this, try to aspirate, which is where they stick a needle in and suck the fluid out and no fluid comes out. Why? Because it's swelling in your tissue. The swelling is between your skin and your tissue. It's that lymph fluid swelling that we get out, well, we get your body to suck it out with manual lymphatic drainage. When you have a seroma, yes, sometimes fluid will keep coming back to the area and they'll keep draining it. But if you are not treating that with manual lymphatic drainage and a proper garment, guys, a proper garment. Okay, if you're not doing that, then you're not gonna get any of that to go away. You're just gonna keep continuing to have to aspirate it all the time. And if you're wearing a bad garment that continues to irritate the same patch, you're gonna keep having that seroma come back or that pocket of fluid. So there's that. How do we get rid of that seroma, cellulitis thing that they keep trying to drain? Proper manual lymphatic drainage, hands-on massage, which we do at Amare, to get your body to dilate and suck that fluid back. Sorry guys, I live next to a firehouse. So that's how the seromas are dealt with. Now, path number 2. When they think it's cellulitis and it's like welts or it's like packets of fluid or it's like that big red area and they treat it with antibiotics and it goes away. Okay, that may have been a bacterial infection from your garment. Guys, if you are not washing your garment with proper detergent, okay, what is proper detergent? Go to our post-op shop. We have the detergent in there. The reason I stress that detergent so much, Tide, Gain, All, Woolite, Arm & Hammer, all of those store-bought detergents do not disinfect properly. They also break down the materials in your garment. I have an entire video on the detergent specifically for that reason. Number 1. Number 2, they do not disinfect properly. And if you're wearing foams or boards that are not the Amare Lipo foam that cannot be washed properly, you're sitting with gross stuff in your garment. Bacterial infection, cellulitis. So go get the soap, the detergent in our shop. The link will be in the bio if you don't have that. So it goes away. Now you're left with the swelling. You're left with a hard patch of tissue because the antibiotics dehydrated the crap out of you, and now you're hard in other places as well. How do we fix that? Amare lipofoams, Amare garment, proper hands-on manual lymphatic drainage. If you don't know how to do any of those, set up a virtual. But there are ways to fix that. That's super easy. So when you're talking about actual cellulitis, that's antibiotics. It'll go down, it'll go away, and then you have to just clean up the area and clean up the swelling and clean up and treat the skin. Super, super important, treating the skin. How to prevent cellulitis in all areas. Treating the skin. Guys, again, I have a video on the soap. Dial and HIPAA cleanse will ruin your skin, make it flaky, which will cause bacteria buildup in your garment, but make it flaky, make it peel, make it thin, make it compromised. Make sure you're using the proper post-op soap in your garments and when you're washing your body, because your skin is in your garment 24/7. I have a whole video on that too. But making sure you're disinfecting yourself properly and not drying yourself out and not causing flakiness or irritation, all of that stuff. So cleaning yourself makes you prevent bacteria growth. Neosporin, bacitracin, and Vaseline will keep you wet and sticky. Yes. Now, not a doctor, not a scientist, but can that cause some bacteria? Yeah, because your scab is sticky and gross in your garment. If it's with a gauze, it's sticking to your skin. Proper wound care, also in our post-op shop, but treating your skin with these proper things to make sure that you're not having any bacteria on yourself. And it's not about bacteria building up on you, it's about making sure that the area isn't in a condition or a hospitable environment for the bacteria to build up, or the microorganisms to build up between your garment and your skin or on your skin. So again, disinfecting your garment and disinfecting your body, making sure that this environment of post-op healing is not going to promote any bacteria, microorganisms, infections, things like that. The third path, when you get it treated and then it comes back, and then you do more antibiotics and then it comes back, and you do more antibiotics and then it comes back. Why is that happening? Now, this is not just for my post-op guys. This is for my lymphedema guys. This is for my diabetes patients with their skin having issues. This is for my people who have severe swelling in their legs where the skin is cracking and peeling, all that stuff. This is very common. They will put you on regular oral antibiotics and then they'll put you on IV antibiotics, and that'll like kick it, kind of, but all that does is kill whatever's in there. It doesn't clear out the fluid and the swelling and repair the skin or any of that. That's why you have to come see us, is to actually clean up that site so it's not promoting that same bacteria again for the cellulitis in your skin and in your tissue. So when you're talking about reoccurring cellulitis where you're constantly having to take antibiotics, one, you need to be getting proper hands-on manual lymphatic drainage regularly. It varies person to person with how many sessions and how frequently, but that's what our virtuals and my holistic consults are for, is to figure out that plan of action for you. That's number one. Number two, whatever you're using to treat your skin, you need to make sure is not going to, again, thin out your skin. Just because it's antibacterial does not mean it's good for your skin. So you need to make sure that you're on something that's antibacterial, antimicrobial, and is going to be treating your skin and help repair it so that it doesn't break again, so that recurring cellulitis doesn't happen. Number three, those antibiotics are going to dehydrate you. They're going to break down, well, not break down, but antibiotics kill everything, not just the bad guys, but the good guys too. So they are going to diminish your immune system a little bit. Now, if this is a reoccurring thing, you are reoccurringly killing off the good guys and the bad guys. It kills everything, which means that your body's immune system, aka your lymph system, and your lymph fluid and your white blood cells, that all goes into the same area, all of that is not going to be filtering out properly or moving properly or anything like that, because you're constantly slowing it down or even putting it to a stop and dehydrating that lymph fluid and that swelling that's in that area and making it compacted and hard, and it's going to come to a standstill. That's going to be a breeding ground for microorganisms, for bacteria. If your lymph fluid is not moving constantly and filtering out, your lymph system is your body's trash system, basically. It takes out all the toxins, it detoxes everything from your tissues, everything from right under your skin all the way down to your bones, your tissue, your organs, your lungs, like your blood, everything. So if that fluid is not moving, because one, you're not moving, two, the antibiotics have dehydrated it and slowed it down, three, you're not drinking enough water, nothing is going to clear out from that cellulitis area. So again, this is not just for post-op, this is for everyone else too. But related to post-op, you guys are already on these antibiotics. You guys are already taking the painkillers. You guys definitely aren't moving. Guys, do you see what I'm saying? We got to be more careful about this stuff. So skin irritation in general, that red hot to the touch area, yes, that's swelling. That can progress and become cellulitis if there is a bacterial infection present or if bacteria builds up in your body. Now, that's what the antibiotics are for, is to make sure you don't get that doesn't happen. Does that mean it doesn't ever happen? No, of course it happens. You guys have weird skin issues, you got garment burn issues, you got all kinds of stuff going on. And cellulitis can be one of those. So we want to make sure that we're keeping everything clean. So to wrap this whole thing up, cellulitis is a bacterial infection of the skin that can be caused by dirty garments, using store-bought soaps, not using our proper post-op soap, using other soaps that dry you out and compromise your skin, not taking care of your incisions, like with our wound care, which protects and gets in there and kills the microorganisms in your little incisions, which is also in our post-op shop, not using the proper wound care, using Bacitracin and Neosporin or Vaseline, something that's keeping you wet, making that habitable environment for those bad guys, and not taking care of your body, guys, not drinking enough water, not moving enough, making sure that you're getting up and moving around and getting your body some circulation. And bad garments, bad pressure in bad garments will do that. It'll cause pockets of swelling, as we know. But if it's causing that much friction, you're going to get a red area, you're going to get a swollen area. And yeah, it can possibly be causing cellulitis, cellular irritation to the skin, to the area, to the tissue, to whatever. So check your garments, make sure you're using the right cleanser, make sure you're using the right wound care, make sure you're disinfecting your garments properly, guys, not just washing them with dial soap, but seriously, like, get the post-op detergent, really wash your garments and your foams and your boards, anything you're putting against your skin, and make sure you're drinking enough water, make sure you guys are getting up and moving, and most importantly, because guys, you're in pain and that swelling is there, the less swelling that is there, the less fluid that is there, the less breeding ground we have for those microorganisms, for that bacteria. So if we get that fluid up and pumping out of you and moving and you're peeing it out, anything that could be possibly sitting in there is coming out with your urine and you're peeing it away and it doesn't come back. So making sure that you're getting not the squeeze massage, not the cutting open of incisions, not the where they're rubbing you with oil, not where it hurts, not where it's machines, not where it's aggressive, but true hands-on manual lymphatic drainage that dilates your lymph system to get your body to suck back the fluid so that you pee it out. That is what's going to be your number one line of defense for all of this bad stuff involving bacteria and cellulitis, is cleaning out your system. Because even if, like I said, you do have anything linger in there, your lymph system is what flares up when you get sick. When you get a cold, this is what swells. You have them here, here, and in the groin area, your hips. But it's everywhere else in your body too. It's how your body filters out all that excess swelling, broken tissue, bacteria, things like that. So when you get a fever and you're sick and this swells up, it's because your body is taking on an immense amount of fluid and it's clearing everything out. That's why they say the number one thing is when you get a cold, stay hydrated, drink a lot of fluids. The doctors will tell you that. So again, making sure you're getting proper hands-on manual lymphatic drainage to dilate these little lymph nodes and lymph vessels to get them to filter out all that fluid so that you can pee it out. That's going to be your number one thing for getting rid of cellulitis. And I have a lot of my diabetes clients, my post-cancer patients, and going through treatment cancer patients, a lot of lymphedema patients that get cellulitis, a lot of people who just have cellulitis in general, where it's like a reoccurring thing and the doctors can't figure it out, and they do research on the internet and then they find out lymphatic drainage helps. Well, I'm telling you, first and foremost, that front line of defense is lymphatic drainage, and you have to make sure that you're cleaning out your system, not just getting squeeze massage, but actually cleaning out your system after surgery, because you have those antibiotics, those anesthesia meds, those painkiller meds, and anything else that you could possibly be taking, blood thinners, diuretics, all kinds of stuff in your system that's gonna put more pressure on top of your body to heal, and you're already trying to heal from surgery and you're already swollen. So making sure that you're cleaning all that stuff out as well as the swelling is super important for protecting yourself, especially against, infections, seromas, all kinds of crazy garment burn, blisters, all kinds of crazy stuff. So anyway, guys, that is my spiel on cellulitis. I hope this was somewhat helpful. I know there's a lot of noise going on around here today. I apologize. But yeah, go to our post-op shop. The gentle cleanser is in there. The detergent for washing your garment is in there. The wound care is in there. And there's some other things in there as well. So guys, I hope this was helpful. I hope that you understood some of this. And I will see you guys next week. If you have any questions, please feel free. You can always set up a virtual consult with me, 732-841-0142. Call our office and our girls will be able to get you set up. If you have questions specifically pertaining to your surgery, specifically pertaining to what you have going on with your healing, and if you have questions or you're freaking out or you need a plan of action, we can give you a straight line and a protocol and kind of give you some clarity on it. So thank you guys. Have a great day, and I will talk to you all very soon. Bye.